now. So all the authors and all the books that we share, and there'll be one every day this month, will focus on the political life, the history of, the memoirs of Black women. So it won't be self-help, it won't be fiction, and it won't be cooking, not this time, but in March, that's a whole nother story. So far, we've featured Loretta Ross, Elaine Brown, Pearl Cleage, Isabel Wilkerson, and that's the book I'm reading now. It's called Cast. She also wrote another book, The Warmth of Other Suns, about how Black folks migrated. Bell Hooks, Patricia Hill Collins, Melissa Harris Perry, Charlene Hunter Galt, and Harriet Washington. So this month, you get a history of Black women, and I'm encouraging you to check that out via Facebook. One of the things that Black Women for Wellness has been doing also is following the news. And we are following the news, not only what they put on our major news outlets, you know, the MSNBCs, NPRs, CBSs, etc., but we're also following news about what's going on in the world with Black folks. So each Sisters at 8, which happens on the second Friday of the month, we're doing a global news roundup, and a different staff member from Black Women for Wellness is doing that each time. And today we have Carmen Taylor-Jones, who is doing our global news roundup. So I'm gonna let her go and share with us some of the news that she has found that is going on with Black folks around the globe. Carmen, are you ready?
Yes, I am. Good morning. Good morning, Black Women for Wellness family and friends. I hope everyone is doing well this morning. I am Carmen Taylor-Jones. I am one of the Civic Engagement Program Managers here with Black Women for Wellness. It is so fitting that we are talking about Black history, African history this morning, because our history is a lot bigger than just what is here in the United States of America. And even for myself, last year, I really started to get interested in Africa, the continent. We have to keep that in front of people, that Africa is not a country, but a continent. And over 16% of our world's population is in Africa, 54 countries. And so the stories that we have actually are very important to Black people, even here in America. Our first story, Jalen had just put it up, is about Kenya. Kenya has a population of approximately 53 million people. It has 47 counties. And this story right here talks about free healthcare finally coming to the aid of pregnant women. This story is very interesting, as each of the stories are. And I would suggest that you guys, in your own time, you actually read these stories, because it's very interesting. On this story particularly, I had to go and actually research to see if the writers and the editors were actually African, because there's the way that they phrase certain things kind of made me feel like it was, they were talking about, it was someone other than Black people talking about Black people, because they refer to certain things very interesting, like slums. They use the word slums very often. They talk about reproductive justice in a very interesting tone. Also, they talk about the free healthcare card, which is a Linda Mama cover. But what is interesting about this particular card, this actually just started in 2018 with a pilot that just ran in 2015. So before that, for all of these people, 53 million people, there was no free healthcare. And so now these women are able to go and to deliver their babies in a hospital versus what they refer to as the risky manner of having a home birth, which we are just now really starting to get into here in the United States, or to have a midwife. And the mama cover, which this article refers to, is for women who could not afford the $5 a month medical insurance that was previously available to them. So we are so happy that healthcare in the form of benefits to pregnant women have come to the aid of our sisters that are living there in Kenya. We'll go to our second article, which is about our Latino brothers and sisters here in America. And this story actually is very interesting. The young lady, if we pull the screen up a little bit, she's a young woman who actually was very supportive in the George Floyd marches that we watched take over the world last year. And in this course of her being supportive of Black Lives Matter, what she reveals is that Latinos here in America for many, many years have been able to benefit from being referred to and classified as white. Many people don't know that prior to the 1960 census, if you weren't Black, you were white. So there are still a number of Mexican Americans that live here that on their census records, they are classified as white. So this article really talks about how the Latino community has to really come to grips with the fact that they have also been able to benefit from white privilege. And they've got to come to grips with that because there are over, over a quarter of the Latinos that live here in America actually are what we refer to as Afro-Latinos. So they are mixed race. But for history's sake, they have always been encouraged to form unions with Europeans that their life cycles would be lightened. And our last article comes from Nigeria. Now, Nigeria is very interesting to me because it is the largest country in Africa. The population in Nigeria alone is 201 million people. The population in the United States is 382 million. So you can see, can you imagine living in all of America and all but a quarter of the people who live here are Black, just like you? That to me is very interesting. But this story talks about a Nigerian photographer who is now really heading up this charge for Nigerians to tell their own stories. You see, even here in America, our news actually always portrays even Black Americans as poverty-stricken and, just disenfranchised on so many different levels. So you got to imagine that coming from Africa to America, have we ever been told the truth about really what happens in Africa? All of the stories that we usually see are poor people fighting, children with swollen bellies and flies crawling in their eyes. But now they are going to be able to start telling their own story. And that is so beautiful. So hopefully we can look forward to more truthful depiction of what it is to be in Africa, living in Africa. And I'm looking forward to that. And that actually concludes our Pan-African news for today. Thank you so much for allowing me to deliver that.
All right, Carmen. Thank you for putting that together. I noticed that for Kenya, you said that they now have free healthcare. And you talked about the number of people there who will be able to access the free healthcare. In the US, we still have not moved to free healthcare yet. I'll be glad perhaps when the US catches up with some of the places that actually care about their people and their population. Do we have a first polling question for folks so we can stay on time? Jalen, do you want to throw up the polling question? Heart attack in women are always a sharp pain in the chest. So That's the question that we're asking. A lot of us have this media image. If we watch Stanford and Sons, we saw Stanford always clutching his heart. If we watch folks on any of the medical TV programs or movies, it's always people clutching their heart. Is that the way women experience heart, a heart attack? Or so you can answer yes or no, and we will come back and give you the answers to those questions. But in the meantime, I would like to introduce our first speaker, and our first speaker is Dr. Carol E. Watson. So, Carol is a professor of medicine and cardiology. She is the attending cardiologist and a professor of medicine cardiology at the David Geffen School of Medicine at UCLA. She is the director of the UCLA Women's Cardiovascular Health Center, the UCLA Barbara Streisand Women's Heart Health Program. She is co-director of the UCLA Program in Preventive Cardiology and director of the UCLA Fellowship Program in Cardiovascular Disease. Dr. Watson is a principal investigator for several large National Institutes of Health research studies, including the Diabetes Prevention Program Outcome Study and the multi-ethnic study of atherosclerosis. She'll tell me how to say that. She is a fellow of the American College of Cardiology and a member of the American Heart Association. She is also a board member of the American Heart Association Western States Affiliate and chairperson of the Scientific Advisory Board for Women Heart, the largest national organization for women survivors of heart disease. So, Dr. Watson, thank you so much for joining us with Sisters at 8 this morning, and you have the mic.
Thank you so much for this important topic. I'm really happy and privileged to be able to speak with you today about how emotions affect heart health. And I want to do a special focus on women. Let me start sharing my screen now. There we are. Okay, so what we know is that all of us are at risk for heart disease, and heart disease is usually at its basis caused by atherosclerosis. But we didn't always know that. And I'm just going to give you some historical documents. This is from a 1964 newspaper article you see over there to the right, where they said the American Heart Association was going to have the very first conference on women and heart disease. Before that time, they only thought about men and heart disease. But this was the very first time they were going to think about women. So when you look at the announcement, you can see it's called Hearts and Husbands. That's a little odd. And then you look further and you say it was basically all about how to care for your man. There was really no discussion at all about women. And we said this is really important for the wives of men suffering from any heart disease. Okay, so they were not thinking about women yet. What about 20 years later? Well, this is 1995, and Reader's Digest asked, are you protecting your husband from a heart attack? Again, no discussion about self-care. So women were excluded from these conversations forever. And as recently as 2015, The Atlantic wonders why doctors still misunderstand heart disease in women. And I would like to postulate that doctors still misunderstand heart disease in women because we neglect to take into account the heart-mind connection. And that's what we're going to talk about today. These are the trends in cardiovascular mortality, dying from heart attack or stroke. And the women are shown in red and the men are shown in blue. And you can see for most of this last decade, women had higher levels of deaths from cardiovascular disease than men. And that really changed about 2015 when men overtook women again, but now everyone's going up. Heart disease and stroke mortality rates are increasing. If you look at 2020 versus say 2010, we're going the wrong direction. And if you look at young women, those under the age of 30, they're dying of heart attacks at even greater rates. So young women are shown in that light red line, and their rates are increasing more sharply than men or overall populations. This is alarming. We can't let our youngest and most vibrant women be lost. A lot of people think about what might be their leading threat to life. And a lot of people don't know that it's actually heart disease. If you look at the overall deaths from heart disease, this is from 2017. You can see more deaths from heart disease than all forms of cancer put together, and much more than Alzheimer's or diabetes or other causes. And if you look at breast cancer, which is a very important pathology and one many women are very concerned about, rightly so, it really is a small percentage of cancer death. And it's something that you obviously have to think and worry about. But when a woman needs to think about their major threat to life, it's always going to be heart disease, because 1 in 3 deaths are caused by coronary heart disease in women, whereas 1 in 31 deaths are caused by breast cancer. Again, very important there, very important pathology, breast cancer, but a woman needs to know what truly is her major threat to life. So heart disease is a leading killer of women, killing more women than all forms of cancer combined. Despite many similarities between heart disease in men and women, there are still important differences. And I postulate that the differences often fall upon that heart-mind connection. And as I'm going to show you in a minute, women of color are at increased risk. So heart disease is especially deadly for Black women. The mortality rates for coronary artery disease are 69% higher in Black women than white women. Mortality from Black women from hypertension, high blood pressure, is 352% higher than for white women. So much of our risk is carried in hypertension. Stroke death rates are 54% higher in Black women than white women. Black women are at greater risk from heart disease, stroke, and all areas of the world. But when the American Heart Association in 2012 asked women to say, what do you think your leading cause of death is? Let's look over to the right there under 2012. Well, most of the white women said it's heart disease. They understood that. But only 36% of the Black women and only 34% of the Hispanic women said it was heart disease. They didn't know that yet. So we have to get all of this information out to the people who are at greatest risk. You heard about the Sanford and Sons heart attack. You remember Fred clutching his chest? Yeah, I remember that. This is actually a classic heart attack picture that's shown throughout all the medical schools in this country. It's a white man. He's clutching his heart as he has a heart attack. But when we think about women, especially African-American women, that's not always what our heart attack looks like. Chest pain or chest discomfort is usually a part of the constellation of symptoms that go along with a heart attack, but it's often not the most concerning symptom to the women that are showing up in our emergency rooms, especially for African-American women. Unusual discomfort in the chest. I've heard more than one African-American woman tell me, my chest just feels heavy. It just doesn't feel right. Shortness of breath is more common in Black women. Could just break out in a cold sweat. Could be just unexplained fatigue, sudden lightheadedness or dizziness, or nausea or sick feeling. These are how women with heart attacks present. It's not always clutching your chest and falling to your knees. And this is a little tongue-in-cheek, but I always say, men and women are different, and some of it has to do with the complexity of our thoughts and emotions and how that all intertwines with our physiology. So if you have a woman and you see her and she says, and you say, how are you doing? And she says, I'm fine. Really, there's so much underneath that fine. When a man says I'm fine, it typically means they're fine. But we have to dig deeper and understand the heart-mind connection to really understand heart health in women. Stress. Stress, we know, can cause heart disease and lead to adverse outcomes like heart attacks and strokes. We've known this for a long time. There have been some really, really stressful events that have happened in this world, and we always see a heart attack strike after them. Take the Northridge earthquake. Do you guys remember that in 1994? Well, they did a nice analysis looking at the number of heart disease deaths that occurred in January in the 3 years preceding the Northridge earthquake up to the year of the earthquake. So look at January of 1991. There's about 40 cardiac deaths in that month. If you look at January 1992, again, there's about 40 cardiac deaths in that month. January 1993, again, about 40 cardiac deaths in that month. But if you go to January of 1994 and look at the day of the earthquake, there was 120 deaths. So 3 times as many deaths that were precipitated by the stress of that earthquake. Very stressful event causing heart attacks. And that we understand. But even more, less global stressful events can cause heart attacks. This is something that is near and dear to my heart because my family are huge soccer fans. But this is looking at the number of heart attack deaths that occurred in Germany during the World Cup when it was on their soil and the home team was playing. If you look at all those spikes there, those are days that Germany was in a very tight match. So again, stress is in the eye of the beholder. I can't tell you what's stressful. You can't tell me what's stressful. If I find it to be stressful, my heart is going to suffer. And this is a cartoon I found when I was a fellow, long before, like years ago. And I thought it was funny. We wanted to make the stress test as realistic as possible. So they had a woman holding a bunch of children, vacuuming, and probably thinking about what she's going to make for dinner, because that is mental stress. And as we have found out, stress of any sort can elicit heart disease. For men, it is most commonly physical stress, like shoveling the snow or running a marathon. In women, it's as often mental stress, like the million different tasks that we have to do every day with not enough time or help. So we were really interested in my lab at UCLA to figure out what's going on with stress in cardiovascular disease, because there are many lines of evidence that suggest when it comes to effects of stress on the heart, women are at greater risk. Heart attacks in young women may be more often precipitated by stress. And again, women appear to be more vulnerable to heart damage from stress. So we wanted to understand the potential sex differences in stress hormone levels. That's the stress hormones, those invisible hormones that are circulating through your body when you're under stress. Cortisol, epinephrine, norepinephrine, dopamine, things like that. The best way to measure them is to collect 24-hour urine, because you excrete those hormones in your urine. So you can actually see how many of those stress hormones are circulating around a woman or a man's body. So we took people who are involved in our multi-ethnic study of atherosclerosis, where about 6,000 of them, we took a subgroup of them and looked at different risk factors they had for heart disease, and then measured their stress hormones. What we found out is that men smoked more, they had higher diastolic blood pressures, and they had lower HDL cholesterol, always thought to be the healthy cholesterol. Women were more likely to take blood pressure medications, probably why their blood pressures were lower. They also had higher body mass indices, indicating higher levels of overweight and obesity. When we looked at their stress hormones, we saw no difference in epinephrine, no difference in cortisol, but women had a statistically significant higher level of norepinephrine and higher level of dopamine. These were measurements that were taken on Monday through Thursday of average weeks. They weren't particularly stressful weeks. These are just everyday measures. So women in everyday life are running around with higher levels of stress hormones in their bodies. What was interesting was when we asked, women didn't look or act stressed, but when we asked them, a lot of them felt stress. but we're really good at hiding our everyday stressors. It just becomes part of life. We don't think about it, but our bodies are still under attack from these higher levels of stress hormones. So despite having lower risk factor burden, women had higher levels of stress hormones. Epinephrine and cortisol levels were similar, but norepinephrine levels were higher, dopamine levels were higher, and these higher levels likely put women at greater risk. That goes back to something that you guys have probably all heard of, called Takasuba cardiomyopathy or broken heart syndrome. It is a non-atherosclerotic type of heart attack and heart failure. That means it's not related to blockages in the arteries, but the heart suddenly becomes dysfunctional and not able to pump blood to the rest of the body. A preceding emotional stressor, also often called a lifetime crisis, like death of a child, is often the cause, or it could be a preceding emotional stressor, like running a marathon for the first time. It turns out that 90% of the cases occur in postmenopausal women. When they looked at the stress hormone levels of people with broken heart syndrome, they saw a similar pattern to what we saw when we looked at our everyday women. So patients with broken heart syndrome had higher levels of epinephrine, norepinephrine, and dopamine, even higher than people going through a heart attack. Those levels remained really high even after a week or more of symptoms. So these stress hormones circulating through the body are not benign. Even though we live with it, our bodies are constantly under attack from it. Now, there are many different stressors. Some of them are psychological, like anxiety and depression. Some of them relate to our social environment, like work stress, maybe marital stress or discrimination. Some of them are structural, like socioeconomic stress, like the fact that we don't all have access to free healthcare, things like that. Loneliness is another important cause of psychosocial stress. Depression, we know what depression is, and oftentimes people don't feel only just sad all the time, but they may have sleep disturbances, insomnia, overwhelming fatigue, feelings of worthlessness. And one of the questions I ask every patient I see in my clinic is, how are you sleeping? Are you sleeping at least 7 hours a night and waking up feeling refreshed? Because poor sleep is often the first sign of depression. Depression can stimulate the autonomic nervous system. That's the nervous system that causes those fight or flight hormones like cortisol, epinephrine, norepinephrine to go. Of all the psychological factors that are associated with cardiovascular disease, depression has the strongest relationship. This is looking at people who suffered a heart attack and how much depression they had and how they survived up to 5 years later. So those who had the highest BDI index means they were the most depressed. That's in that gold line at the bottom. They had the poorest survival. Those who are less depressed in the green bars or the red bars had greater survival. And the best survival were in people who really didn't have much depression, the blue line up top. And again, this is controlling for other risk factors. So really they tried to isolate the depression as a risk factor. A lot of things happen when you're depressed. You can see women appear to be more at risk from depression as a risk factor for heart disease than do men. You can see over there on the left, women have a much higher rate of coronary disease if they are depressed as compared to men. And especially if you're a woman who's under 55 years of age, as you see on the right, the higher your levels of stress and depression, the higher your risk of heart disease. A lot of things go into being depressed. You don't always take care of yourself the way you should when you're depressed. You may stop taking your medications. So you can see that people who are depressed in purple don't take their medications as prescribed, forget to take them, or in fact, on purpose decide to skip them as compared to people who are not depressed in burgundy there. Anxiety. Anxiety is also another big stressor. So It's your body reacting in a fight or flight manner to perceived stress when none truly exists. And that is something that can definitely increase your heart disease risk. In a 32-year-long study, it was called the normative aging study, people who reported more phobia or anxiety symptoms had about a 320% increase in the risk of fatal heart attack and a 570% increase in the risk of sudden death. And there's a lot of it has to do with frame of mind, how you frame things. And we always try to be optimistic and happy, and there's really good health reasons to be that. So optimists tend to see negative events as temporary and positive events as more permanent. Optimists tend to attribute negative events to really random, temporary external causes, and they don't condemn themselves. Pessimists tend to have the opposite, and we'd all like to be optimists. There's really good health reasons to be optimists as well. Because if you look at cardiac events, people who are pessimistic, shown in blue, have much higher rates of heart pain, angina, and much higher rates of heart attack and death, as compared to people who are neutral in red, or people who are optimists in green, who have the lowest rates of such events. And it's all just this reinforcing cycle. The stress, the anxiety, the depression, the pessimism causes surges in these stress hormones. These stress hormones in turn cause more cardiac events like heart failure or heart attack or stroke. And that also causes you to be stressed or anxious or depressed. So it's a reinforcing negative cycle that has to be interrupted. How can we interrupt it? Well, one of the best ways to sort of immunize yourself against some of these things is with social relations. That's why organizations such as this are so important. You all are not only providing education that's vital and important, but you're providing social contacts in a social community that can save your life. There's a vast literature on social networks, social support in heart disease. One study from Alameda County showed that people who lacked ties to others were about 2 to 3-fold more times more likely to die over 9 years, including from heart disease related causes. This is a study shows that those who have the smallest social support networks, shown over on the left, both for men and women, have the highest rates of death. And the larger and the stronger your networks are, the lower your mortality rates are. So having a strong social network is vital. We can laugh. There's many studies that show that, fake it till you make it. Even if you're not feeling well, if you can start to laugh, your mental stress goes down and your vascular function improves. So in this study, if people at baseline, they measured how well their vessels reacted, they were able to dilate and deliver more blood. As soon as they started laughing, the vessels were able to deliver more blood. Their vascular function improved. If you look on the right, if they started them out, but instead of showing them a comedy and making them laugh, they gave them a mental stress test, which is like asking them to do really fast arithmetic or making them do a public speech, and their vascular function declined. So laughter improves function, stress decreases it. And having a purpose in life. And that purpose can be whatever it is for you. But feeling that your life has purpose is a way of immunizing yourself against some of these risks. Mortality rates go down or lower for people who have a high purpose in life versus those who have low purpose. So we are very big proponents of mindfulness at UCLA. Mindfulness is just the awareness that emerges when you start paying attention on purpose, being present, being non-judgmental, just really thinking about your ideas and your thoughts. Most of us spend each day with a lot of internal thoughts. We have these silent conversations with ourselves all the time. Mindfulness is purposefully listening to that voice and being present. There's an app at UCLA, which is free, called the UCLA Mindful App, which you can download from iTunes or Google Play. I highly recommend. They have studio recorded guided meditations. They have weekly podcasts. They have really important tips for health and wellness. So stress and health. If you have injury, illness, discrimination, it causes stress, anxiety, or depression, it could be other things like a history of childhood abuse. It could be family stress, it could be work stress, any perceived or real injustice, fear, avoidance, isolation, and you can start getting this catastrophic thinking. And when you do that, you may not actually take as good care of yourself as you should. You may stop exercising, you may smoke or drink more than you should, you may eat poor. Stress hormones are mediating most of this, we think. And that causes some real physiologic reactions, like your blood pressure goes up, your glucose levels go up, you become less healthy, and that can increase your risk for heart attacks, strokes, and death. So we have to break this cycle. We have to try to do something because stress causes disease. We need to cut this cycle in health because if we keep on doing what we've always done, we'll just keep on getting what we've always gotten. We have to really interrupt the stress cycle so we can improve health. Thank you very much for your attention. I really enjoyed being here with you all, and I think the work you're doing is so important.
Thank you, Dr. Watson. That was like really, really informative. And I understand that you have to run to your next appointment. But I did have two questions, and I wanted to give panelists an opportunity to ask a couple of questions also. So it feels like there is a lot of work going on at UCLA around cardiovascular health, and especially looking at it from a holistic perspective. So my question is, how do community members, those of us who are not at UCLA, become involved? Because I imagine that particularly if a lot of heart disease is happening with Black women 30 or under, and that's like a real startling number, that we need to get involved. We need to learn more about this. So how do community engage with UCLA to take advantage of the information and become part of the research, et cetera?
Yeah, that's a fabulous question. So one of the things that we do in our Women's Cardiovascular Center is we do outreach to vulnerable communities that haven't always been involved. And that is a real, that is my passion project, is stepping outside of our privileged community in West LA and going to all different areas, bringing this information and bringing them to UCLA or us to them to try to get this information out. And I hope they will give you my contact information because we are always looking for partners.
Okay, so we'll see about those partnerships. And then my second question is that I imagine, especially if it's women under 30, that a lot of heart disease is undiagnosed.
A lot of heart disease is undiagnosed, and that is tragic. So one of the things I ask everyone is to know their numbers. Make sure you have asked a healthcare provider what your blood pressure or your glucose, your cholesterol is, know all those numbers, and know your family history. So many of us don't ever. I know in my family, even though for years I was told that my grandmother died of indigestion, nobody dies of indigestion. It was a heart attack. And those are things we have to sort of be aware of. And also know the symptoms. So what I tell all my women, any abnormal symptom from your navel to your nose comes on with exertion, be it physical or emotional, and goes away with rest, you have to get it checked out. That could be your heart.
You want to say that one more time?
Any unusual sensation from your navel to your nose comes on with exertion, but be it physical or emotional, and goes away with rest, you have to get it checked out. It could be your heart.
Thank you. Thank you so much. And I think that's an easy way for people to remember something like that, navel to nose with exertion. All right, I don't see any other questions in the chat. And of course, we are running over time. So thank you so much. And I'm going to bring on our next speaker. So I have my reactions are not here because sometimes you can do like the little exploding thing on Zoom, but not today for the panelists. Our next, thank you, Dr. Watson. You are very much appreciated. And yes, we will be reaching out to see how we can become more involved with you. Okay. Our next speaker is Dr. Zuraf. And I am pulling up her bio right now. She is on staff at Martin Luther King Jr. Community Hospital. Her specialty is in interventional cardiology. She speaks at least 3 languages. A graduate of the University of California, San Diego School of Medicine, and has been at UCLA, Harbor UCLA Medical Center, and her postgraduate training was a cardiology fellowship. So Dr. Zaraf, please take it away.
Good morning, and thank you very much for this great opportunity to be part of this amazing program and to be on a panel with such a distinguished speaker as Dr. Watson. And before I start on my slides, I would like to echo what Dr. Watson said, is we're always looking for women who need to be evaluated and taken care of. And I have the privilege of being at Martin Luther King Community Hospital that serves a population that has a very high need of specialty cardiology care. And I will echo some of the things that Dr. Watson had talked about in her talk, but we'll focus a little bit more on the treatment and prevention of heart disease. So when we talk about the strategies of treatment of heart disease of a woman who already has a heart condition, the most important is to really concentrate on lifestyle changes. And of course, we have tons of medications and procedures, but the reason lifestyle changes are so important is because they are the most lasting changes that a woman can make in her life, and it will affect her own health and outcomes, but also the health and outcomes of the community and of her family, because if everyone's being healthy, if the woman is being healthy, everyone is being healthy around her. And so, of course, after lifestyle changes, we add medications, and then when this becomes insufficient or more treatment is necessary, then we move on to more invasive options such as procedures and surgeries. And so, again, to echo Dr. Watson's talk, management of stress is one of the most important lifestyle changes you can make. We are living through a pandemic, and the American Psychological Association published at the end of last year a report saying that not only are we living through a pandemic of COVID-19, but a pandemic of stress. 8 out of 10 Americans say that the pandemic is an additional source of significant stress in their life, and 7 out of 10 have experienced increased stress over the last year. And that stress is psychological, it is about, and also physical. It's worrying about livelihood and income security and housing, but also bereavement. And many of us know someone close to us or even a family member who has struggled with COVID or who died because of this disease. And you'll see the same slide. It is a vicious cycle, and also a cycle where stressors and anxiety and a mental health illness affect our hearts and our risk of having a cardiac or stroke event. And believe it or not, it really hasn't been until the last decade where we've really been able to prove that there is a physical connection between mind and heart. And anxiety and stress not only affect your mental health, but they cause all these levels of increased stress hormones, as you've heard, increased cardiac reactivity, meaning increased heart rate and increased blood pressure, and actually reduced blood flow to the heart muscle itself, which can cause it to dysfunction. And so as a result, people under chronic stress have increased rates of stroke, heart attack, heart failure, and metabolic diseases like diabetes. And why are we talking about this today? There are 3 groups of 3 populations that are at especially high risk of developing cardiovascular events as a result of chronic stress. And these groups are women We know that women who suffer post-traumatic stress disorder and depression are at a much higher rate of having heart disease than men, and it probably has to do with those increased levels of stress hormones. Women and men both who are in a relationship with someone who has post-traumatic stress disorder are at a much higher rate of having increased heart disease. And post-traumatic stress disorder in these circumstances does not necessarily have to do with some major traumatic event. Things like surviving COVID hospitalization. At my institution, we actually have a behavioral health clinic dedicated to patients who survived a stay in the ICU, and they truly suffer from post-traumatic stress disorder. And this also adds attention to the caregiver stress. Taking care of someone who's been through a major stressful event puts them at risk for having heart disease. And then racial and ethnic minorities. As we heard, disparities in social determinants of health, access to care, adverse child experiences, structural racism and discrimination, all of these things cause depression, stress, and anxiety. And in these populations also cause physical manifestations like high blood pressure, heart disease, and worse health outcomes. And what are we really talking about when we talk about these adverse childhood events? So in the past decade, the Kaiser Health Foundation did a study on over 17,000 adults, and they actually did a survey of their members, and they asked them 10 questions relating to their childhood, so events that happened under the age of 18. And they asked them 10 questions about whether they've witnessed or been a victim of physical, emotional, or sexual abuse, if they felt physically neglected, such as not having enough to eat, or not having a safe place, or emotionally neglected, feeling unwanted or put down, and then living through household dysfunction, living with someone who has mental health illness or substance abuse, or witnessing domestic violence, or being in a family where there's an incarcerated relative, or going through parental separation and divorce. And having any of these adverse childhood events predicted future chronic diseases. And what's remarkable is that of these 17,000 adults, 60% had at least one of these events. So psychological trauma is common in our society, but 16% of the people they surveyed had 4 or more of these adverse events, and they were more likely to be women and more likely to be women of a racial or ethnic minority. And why are these events such important? Because when they do occur in conditions where there's also chronic stress, such as living in an underserved or under-resourced community, a segregated neighborhood, having food insecurity, causes toxic stress. And this is something that causes an increased risk of health problems. And what are these health problems? So the consequences of these events are not just high-risk behaviors, but actually all the chronic illnesses that we know affect and shorten lifespan, like severe obesity, diabetes, depression, risk of suicide, heart disease, cancer, stroke, and trauma. So what can we do as individuals? What can women that are part of these communities do to mitigate their risk? And the most important aspect of this is really recognition. So not only knowing the symptoms of depression, anxiety, and health disorders, but also talking to someone about it. And knowing that if you have had any of these adverse childhood events, you are at increased risk for heart disease, and your mental health and heart conditions are related. And again, very important to know what your risks, genetic risks are. If depression runs in your family, you are more likely to also experience depression. And so is true for heart disease. And so how do we know when depression is at a point where we need some help? So all of us have been through stressful situations. We are now living through a time when there's a lot of grief and loss and bereavement. And so having symptoms of feeling down and having trouble sleeping for 1 or 2 weeks may just be that. And at that point, we need to know how to take care of ourselves, engage our own coping mechanisms, our social network to help us. But if these symptoms start persisting past 2 weeks and now are affecting our ability to function, we're finding it hard to get up and go to work, or do housework, or take care of our children, this is when we really need to reach out to a professional. And what can we do before we get to that point? So some of the more important ways of managing stress are these effective coping mechanisms. So you don't have to do all 9 of them. You can choose the one you like, but these are some of the examples. Doing exercise, or reading a book, or just practicing gratitude and positive thinking, doing yoga. So any of these, or a combination, are all effective ways of managing stress. And why do we know they're effective? Because people who are good at coping tend to engage in these activities. And people who are good copers also have excellent resilience, and resilience not just to emotional stress, but to heart disease. And so that's very important. Now, Dr. Watson talked about the UCLA Mindfulness Awareness Center, and it's a wonderful institution, and you should absolutely download that app. And what they and others have been able to show is that a specific kind of meditation, this mindful meditation, or called Transcendental Meditation, is sometimes as effective or more effective than the medications we have in treating high blood pressure. So in this panel, you can see decreased blood pressure. The blue bar had the highest decrease of blood pressure than all other stress techniques. And what's even more remarkable, in patients who already had heart disease, they were able to show a 50% reduction of future events by practicing transcendental meditation. So what is it? You don't have to be a Buddhist monk perched at the top of a mountain. It's really just focusing on your breath. And there are plenty of free apps that you can download on your phone, and even 5 minutes a day will give you health benefits. And what does the health benefit entail? So focusing on your breath, and you can kind of read about that. So what are the other things that we must do to treat ourselves and to prevent heart disease, and also to help our hearts mend? So quitting smoking is absolutely essential. We know that smoking actually causes direct damage to the blood vessels of our heart. It makes your good cholesterol go down and the bad cholesterol go up. It also promotes clot formation, which means more likelihood of a heart attack, and it promotes plaque buildup, which means more narrowing in the blood vessels of the heart. And if you look at the right-hand panel, you will see that most racial groups are participating in smoking in our country. And on the left-hand panel, what you'll see is actually United States doesn't have the highest rate of smokers, but where we are unfortunately remarkable is that we have the highest percent of women smokers. And if you needed a reason to quit, quitting smoking in any time of your life will gain you time of life. It will gain you years. So smokers quitting in their mid-20s to 30s will gain 10 years of life. And even those who have smoked their whole lives and are quitting in their 50s and 60s will still gain time. So what else can we do? We've all heard about the Mediterranean diet. The panel on the right shows a very famous study called PREDIMED, where they studied several thousand of people. And what they found is that people eating a standard diet were having their regular heart events. But if they were eating a Mediterranean style diet, which meant lots of either nuts or extra virgin olive oil, they were able to reduce their chance of having a cardiac event by 30% in just 5 years. And what is this Mediterranean diet? Well, it's really a lifestyle. If you look at this pyramid, you will see that the most important bottom panels are keeping an active lifestyle and eating a diet very high in fruits, vegetables, unprocessed foods, olive oil, but also beans and nuts and legumes, so unprocessed food, with the main source of protein coming from fish and seafood, and then sparingly eating all the other more guilty pleasures of food. And why is this diet so important? It has benefits for all the diseases that increase the risk of having a heart attack. So It improves your diabetes control by making you more insulin sensitive and lowering the blood glucose levels. It reduces the chance of stroke by making the blood a little bit less sticky. It lowers blood pressure and makes your blood vessels function better, decreasing the chance of heart attack and stroke, and also improves your cholesterol. And we don't all live in the Mediterranean, actually none of us probably. So what is this Mediterranean diet? It's really, if you look at these three panels, they're different cuisines, but you will notice that all of them have a rainbow of colors. So every meal should include fresh vegetables and fresh fruit, beans, grape, and whole grains. And when you're shopping in a supermarket, just remember, stay at the perimeter. So if you think about all the foods that are the perimeter of the supermarket, that's your produce, the dairy, the fresh meat and seafood, all the things that are not processed and packaged. And avoiding processed foods and sugary drinks is also key. So exercise is another excellent way to mend your heart, but also to prevent heart disease. And what is exercise and how much I should be doing? So the American College of Cardiology and the American Heart Association recommend that you exercise 150 minutes a week. So what does that really mean? So here you can see what are some of the activities. So just moving, walking, swimming, bicycling at a slower rate, dancing, doing some yard work, and home exercises is enough. So just 20 to 30 minutes a day is all you need to keep your heart healthy. And why is exercise so amazing? Well, if you look on this graph, the blue represents death from heart disease. And on the bottom panel is the amount of exercise. So the more you exercise, the more benefit you get. And even a little bit is better than nothing. So even if you can't do those 20 minutes a day, do 5 or 10, you will still get the benefit of decreasing your risk of death from a heart event. And of course, there are other benefits like better blood pressure, reduced risk of depression and anxiety, better diabetes control, and better sleep. And once we've incorporated these lifestyle changes, then we move on to medications. And the medications really focus on management of risk factors. So management of conditions that increase the risk of heart attacks, like high blood pressure, high cholesterol, and diabetes. And we're not going to go through each one of them, only to say that, again, we're seeing a huge disparity in outcomes based on race. Look at this table. Black patients with diabetes are less likely to have their blood sugars controlled, their cholesterol controlled, and their blood pressure controlled. And it is not because there's a difference in side effects or effectiveness. It is because physicians are less likely to prescribe and intensify therapy. So it is really on the women and the patients themselves to push their physicians. And what about women? Look at women with diabetes. Compared to men, they have twice as likelihood chance of developing heart failure, heart attack, and dying of a heart attack when they have diabetes compared to men. What about high blood pressure? Again, the Black community has a huge burden of hypertension compared to any other racial group. And what's even more important, women suffer a higher risk of cardiovascular disease and complications from high blood pressure compared to men. And what about cholesterol medicine? Well, we all know about the potential side effects, but they work. And look at the black bar compared to the white bar on this graph. There's a huge reduction in mortality in every age group with statins in both men and women, and the effect is equal. But women are about a third as likely to be prescribed these medications as men. So once we've done the medications, then we move on to the more advanced therapies. And really, this is to say that at this point, we really need to be taken care of by a specialist. So a woman who already has heart disease or has had heart damage from stress must see a cardiologist and must have access to all these adjunctive therapies that make our patients live longer and more productive lives. And really, I think the point of all of this is to say that you must be your own advocate. Know your risk factors, know your family history, and know how to manage your own stress and recognize when your stress and anxiety are enough to really make sure that you see a professional and get help. And remember, women are the drivers of healthcare in our communities. By making ourselves healthy, we also make our families healthy and really make everyone around us better and healthier and more productive. Thank you very much.
Thank you. I wanted to, if you can keep your last slide up for a moment, I wanted to, risk factors unique to women, and to make sure that people see that information right there. Menopause, ovarian cyst, or high blood pressure and
diabetes during pregnancy, right? So we talked about young women in their 30s. So a lot of times, you know, you'll go and see your male physician and they won't, you know, and now a woman is in her 40s or 50s and they will not ask about her obstetric history. But it is a very, very important risk factor for future heart disease, having had these conditions during pregnancy.
Sure. And I think that I didn't know, just in terms of, I've heard a lot about gestational diabetes, but did not know it could be a risk factor for heart disease as we grow older.
Right.
Okay.
Sure.
I think one of the other things that you said that was truly important is that it's not that the medications don't work, it's that the physicians don't prescribe the medication, or they don't treat your conditions as seriously or as aggressively as they should or could. Correct. And that goes to some of the work that Black Women for Wellness has been doing around implicit bias of physicians. So thank you so much for saying that. Those were my questions, and I really, really appreciate your presentation. Thank you so much, Dr. Jarrah. It is great to not only talk about what the setup in terms of what Dr. Watson talked about in terms of the grief, the depression, et cetera, but also the treatment and the lifestyle. That's one of the things I have learned very early, to shop the perimeters of the grocery store. Just don't even go down those middle aisles. We don't need that. If you could stay for a couple of seconds in case there are questions, but I do want to get Pastor Juanita on because time is moving forward. Pastor Juanita Strong Matthews is the president and co-founder of Springs of Hope Grief Care Center. This is a nonprofit located in Long Beach, California. Her mission is mending the brokenhearted. Pastor Juanita, as she is affectionately known, is an ordained minister currently serving as the assistant pastor at Prevailing in Christ Ministries in Carson, California. She is also a chaplain with the Long Beach Police Department. For over 20 years, Pastor Juanita has provided grief care services worldwide. Her family has suffered trouble, tragedy, and major life changes over the years, the worst of which occurred with the tragic death of her nephew, Ron Settles, in 1981, and her son and his 3 children on Mother's Day in 1992. Ooh, I'm so sorry. By the grace of God and the power of God's love, she and her husband, the late Larry K. Matthews, rose from the ashes of these tragedies with an intense desire to help others. Out of the depths of great pain, they found great purpose and co-founded the Springs of Hope Grief Care Center. Thank you, Pastor Juanita, for joining us with Sisters at 8 today.
Good morning.
Thank you.
Thank you so much. Thank you. Good morning, everyone. It's such a great honor to be here today. Thank you so much for this opportunity to share a few thoughts on matters of the heart. First of all, I want to offer, before we get into the slides, I really want to take a minute to offer my condolences and prayers on behalf of all of those who have suffered loss on any level, especially the loss of special loved ones. I understand how much it hurts to lose someone special. In the face of COVID-19 pandemic, we've taken some very intense emotional hits. And I think I'm so thankful for the previous speakers because they really lavished us with a great deal of knowledge. So I want to just share some thoughts this morning on, since we are surrounded by people who are stressed out, depressed, full of anxiety, fear, and anger, just to name a few, as the previous speakers have mentioned. I understand that the suicide rate has increased among children, if you can imagine that, between 6 and 10-year-old. People all around us are suffering. Families are in crisis because of unemployment, financial crises, sickness, sick and quarantined at home. People have relatives in the hospital that they can't visit. Funerals are taking place on a virtual platform in many states and in many cities and in many cases. And we're just at a different level of hurt and brokenness right now. And so because of that, our hearts are broken. And so I just want to talk about, so what becomes of the broken-hearted? What can we do? How can we help? How can we mend the broken hearts? It's my great pleasure to talk about heart health in relationships. And I just want to share, Antoinette said that this should be solution driven. So I want to say broken hearts lead to broken families. So I'd like to offer a few recommendations that I hope will be helpful to these precious families. For couples and families that are housebound, lately I've been able to share with couples and just a few points that I'd like to share before we get into the PowerPoint. One is pay attention to those in your household and try to develop a routine or a habit of self-care. I heard, I think Dr. Watson talked about self-care. Pay attention. Secondly, make time for breaks like midday exercise, go outside, take a short walk, or take a few minutes for inspiration to break the monotony. This is for people who are homeschooling, people who are working from home. Take a few minutes to take a break. I'm told that it's very helpful. And limit the work days, set boundaries around your work schedule, and then plan and do something fun with the family and for the family. Okay, and then I wanted to share, be willing to fight for your own emotional health and that of your family. Well, how can you do that? I'm going to talk about a few things here. Number one is love. Be willing to love without limits. Be willing to forgive, be patient, really care and go the extra mile. Do more than usual, be kind. Kindness is powerful. Secondly, communication. Good communication is critical, especially now. Learn to listen. One of our greatest gifts right now that we can give to another person is our undivided attention. Listen without interrupting. Pay attention to your children, listen to them, watch them, observe them. Next one is trust, and that should be mutual. And then respect, that should be mutual. And then number 5, the last one, is be willing to invest in others' responsibilities and interests and values. Pitch in to help with household chores and tasks. Just be mindful of one another. I just wanted to share those few things that can help us in the family, those who are quarantined, many are housebound. And so if we are mindful of one another, I think it's helpful to heart health in relationships. And now for the PowerPoint, I'll go to, if you would go to slide number 4. I want to talk a little bit about grief, a little more than I've heard already. Grief is everywhere. Everything that we've experienced in the last year has been a grief producer. So grief is universal, and people all around us need help. Grief is a normal reaction to significant loss, especially the death of a loved one or other major life changes. Grief is painful. It hurts to lose someone special. Grief is awkward. It is a time when we are strong yet fragile and yet vulnerable. So it's awkward. In addition to that, people really don't know what to say to you when you've experienced a death, especially, and many times they say the wrong thing. Grief is also disruptive. It is always untimely. Grief, another thing I want to say about grief is that it waits. If you don't deal with it, it will wait for you. I've worked with many families that did not deal with grief. It can make you physically sick, as we've already heard. And grief is what we do at the Springs of Hope Grief Care Center. Is basically caring for the soul. We care for the soul. As we move to slide number 5, we'll see some signs and symptoms and expressions of grief. These are typical responses, and you may recognize some of these, or you may recognize that people around you may have had some of these. I have no energy. This is a typical response. Always exhausted, muscles tight or weak, body in pain. I'm fidgety and I'm restless. And it's an expression or a symptom or a sign of grief. As we move to slide number 6, we'll see more typical symptoms and signs. Unable to sleep, sleep constantly interrupted, disturbing dreams, insomnia. And I heard one of the former speakers say that many times that's a sign of depression. And so there are things that we can do about that. I just wanted to show you these symptoms, these signs, these expressions of grief. And as we move to slide number 7, we'll see that our eating habits are upset. We may have no appetite, or indigestion, or diarrhea, or excessive weight gain, or weight loss. We may have nausea or overeating. These are signs, symptoms, and expressions of grief. Moving on to slide number 8, we'll see more signs, symptoms, and expressions of grief. This one says, help. I'm going through physical changes, heart palpitations, tightness, heaviness in the throat, headaches, nervousness. These are all signs, symptoms, and expressions of grief. Moving on to slide number 9, more signs, symptoms, and expressions of grief. And so you see, grief is really something that we need to talk about, something that we need to work with people through, something that we need to focus on. If this one says, help, my emotions are out of control. I'm crying all the time. I'm sad, I'm depressed, cannot get up from this valley of grief. And so there are things that we can do to help ourselves and to help each other. Moving on to slide number 10, more signs, more symptoms, and expressions of grief. Usually when I go through this, people come back to me and say, I didn't even know I was grieving, but I realized I am. So this one says, help, it feels like I'm losing my mind, can't think straight, mind seems scrambled, anxious, and I'm fearful, I'm guilty and disconnected. Okay, so these are signs, symptoms, and expressions that you can identify and either help yourself or reach out to get help. Reach out. I say reach out to someone. Moving to the next slide, slide number 11. Reach out to someone that works with grief, a grief counselor. We help people through the grief process. There was a time when my family experienced grief that we had very little knowledge about it. Very few people around us talked about it, and there were no resources that we were aware of where we could get help. And so it's one of the reasons why we do what we do today, because my family went through a horrible tragedy several times over. And so now we want to help other people. If we could move to slide number 11, that would be wonderful. We are here. We are here to help you. During the grief journey, people need support, people need care, people need comfort, people need hope, people need help, and people need safety. People need to know that when they reach out to you, that it's a safe place for them to reach out. People need help and care. People need compassion. And that's hopefully what they get when they reach out. Moving to slide number 12, I wanted to show 8 ways that a person can get a grip on grief. All right. Our organization is faith-based, and so we help people. We minister to people through the Word of God, through prayer, and when we talk about meditation, we are talking about it through the Word of God. So we encourage people to use prayer and meditating in the Word of God. My experience was that nothing brought me peace like the Word of God and prayer. And then we help people discover the power of music. I so much enjoyed the music at the beginning of the presentation today. We help people discover the power of music. Music is powerful, and in many instances, it can serve as a medicine to soothe and calm the restlessness that is in the soul when a person is grieving. So we help people discover the power of music. And then we encourage people to lean in to the pain. It's similar to when you go and have blood drawn, and they say tighten your fist at first and then release it. Well, leaning in is like that. It helps you release the tightness in your body. It helps you to breathe. It helps you to just lean into the pain and not push back and try to resist it. So that helps people. Then the next thing is to reach out to others. Reach out on two levels. Reach out to help someone, or reach out to get help for yourself. In this situation, reach out to help others. It helps sometimes to share with others, because when you share with others, you're going to discover something new, either about you or about them or about both, that's going to help you. So share, discover, and then create something new based on the way you reached out to either help or get help. Okay, and then we encourage people to create and celebrate. Once you create something new, as you go through this process, you're learning things about yourself and about others around you. So create, excuse me, and celebrate, connect with others. Nothing takes the place of human connection, nothing. So create and celebrate when and wherever you can. The next one is write. I encourage people to journal. Make a list of your griefs. And then many times when you sit down to make a list of your griefs, there are things that will come to your mind that you forgot about, that maybe you need to deal with. Okay, and then read, engage the mind, engage the brain. This is critical during this time. And I'm talking about getting a grip on grief, because if you don't get a grip on it, it will get a grip on you. Okay, and then exercise. We heard that already, exercise and rest. And I'm so glad to have the numbers. She said 150 minutes a week, at least 150 minutes a week. That's great information. Walking is so important. And it's one of the things that I've always used to help myself in self-care, walking at least 30 minutes a day. And it just releases the stress and the tension that would otherwise have you all bound up. So I want to encourage anyone today to start where you are. Start where you are in this process. Use what you have. We've shared some tools. We've been just lavished with information today. And then do what you can today. Grief is a daily process. Grief is a one day at a time process. So every day, just start where you are. Try to identify where that is. What am I feeling? Where am I today? Start where you are. Use what you have. You have tools around the house more than likely, and then do what you can to help yourself and other people around you. Okay. And then I heard somebody say this earlier. I want to say love, listen, and laugh. Laugh as often as you can. Proverb says that laughter is good like medicine for the soul. Okay, so laughter is like medicine to the soul. And then I want to share this also. We have this hope. Hope is an anchor for the soul. Okay, we try to build people up, and when they come into the center, most of all, we want them to know that, you know, I want people to know, I see you, I hear you, and you matter to us. We see you, we hear you, and you matter to us. Okay, and then that is it in terms of my presentation. Thank you. Black Women for Wellness. I'm so grateful to have had this opportunity to share with you today.
Actually, Pastor Juanita, I am so grateful that you took the time to share with us today. Your information was so important for us to hear. That love, the laughter, the solutions that you put forth to say, I feel heard, and, you know, coming to a safe place. Thank you so much. And I think it was the perfect way to round out this 90 minutes that we have spent talking about heart health. One of the things that I wanted to put an explanation point on you is, and what you were talking about is music, and the treat that music is for our spiritual and mental health. When we played the music at the top of the program, it took me on a walk down memory lane, right? I was like, oh yeah, I remember that song and what I was doing. And that's what music does. And I think during this last year, while many of us are grieving people, and I know we had talked about one of the things that we can do in the chat is put the name of people that you are grieving right now, right? Because we don't say their names often enough. And that's part of let's not pretend people just, disappeared into the ether or whatever. Say their name, right? And say also that what we are also grieving is this shift of lifestyle and of the world where we are right now. So thank you so much, Pastor Juanita. Thank you so much to Dr. Zeroff. Thank you so much to Dr. Watson. This has been a wonderful and excellent program. And also I want to thank Antoinette Drone and Dr. Jesse Sherrod, because I know they worked very hard at pulling this together. I just came in yesterday and read your bios and talked, about what order we're going to go in. So, and thank you to all the folks who are putting names in the chat, because that's what I want you to do. Is Breonna Taylor? Yes, but is Veronica Mays Jackson? It is those folks that we have been touching in our life, right? And I think that's also one of the things we need to talk about, hugs, and how important hugs are, right? And how important touching is. So we actually had put together a couple of things. We're at 10:29, so we really pushed it on the time. But we had put together a list of things to do for your friends. So Valentine's Day is coming up. And a lot of people might be grieving because they're not in the relationship that they want to be. But I want to say, let's emphasize the importance of friends, whether it's your girlfriends or your male friends. But friends are so important because you can talk, they can help, you can listen. All of that stuff goes on with your girlfriends. And let's celebrate that love we have for our friends and how it makes our life so much more bearable and so much more happy when we have girlfriends in our life. So, the list, Jalen, if you have it, of things that we could do for our girlfriends or for our friends, from planning on what we're going to do when we move past this stage of the pandemic to what we're going to do this weekend. We also had a list of songs that, we thought we could play also, just in terms of, songs that lift you up and give you joy. And we also have a list of movies that are affirming. One of the things that I miss right now is going to the movies, but we have a whole list of movies that are available on Netflix and on Hulu and all of the Amazon, all those different places where, we can like watch a movie, and we can watch a movie, with our girlfriends or with our intimate romantic partner friends via this two-dimensional screen right now. So, so Valentine's Day might look different, but let's go through this real quickly because it is 10:31. Gift baskets, we can exchange cards, we can have a do-it-yourself card. Moving on. I actually have a lot of friends I didn't realize who are born in February, those Aquariuses and Pisces. So, and one friend, Ajoa Jones, found a whole list of Black bakers in Los Angeles who deliver. So if you are in Los Angeles and want to send some sweet treats, hit us up on Facebook and we will send you that list. So love letters. Don't think of love as a romantic relationship. Think about all those people that you really do love and love having in your life. And then think of it also as a romantic relationship too. There's nothing wrong with writing a love letter to the person that you love in a romantic, intimate way. But if you love your children and you love your parents and you love your friends or the people you work with, write them a little note too. It is important to acknowledge all the good and the love and the joy that we are experiencing in this world. And that's why I liked when you said, Pastor Juanita, just love, just enjoy the love. Want to keep moving? Yeah, get over your ex package. So if you know one of your girlfriends is getting over that ex, send them a care package, send them those self-esteem cards and quotes. Give yourself some loungewear. Lord, we've been wearing some loungewear and some sweats, and I pulled this dress out today. It's been on the hanger so long, it still has the hanging, imprint of the hanger on it. Next. It's been a long time since I virtual movie night, in person, or a virtual slumber party. Next. We talked about that. Vision boards. Pastor Juanita, one of the things you talked about was being creative, right? And it is so important to express your creativity, even if you don't think you have any, right? So when you're doing your journal, part of what you can do with your journal is just free write, just write. Don't think about what you're writing, just write. And then that creativity, it doesn't have to be something that's going to go in the art museum. It's just for you. It's just how you are expressing yourself. So we are not all expected to be wonderful, fabulous artists, but we all have some creativity. And sometimes our creativity expressed in other ways. Some of us cook creatively. Some of us do other things creatively. So don't think of it as that in that way. Plan a future trip. Oh, I'm so looking forward to travel. We're gonna move on now.
Okay.
All righty. So the rest of this stuff we're gonna post on our social media, and also
I have something I'd like to share. I thought you guys had it, but the Hope Table Talk.
I don't know what the Hope Table is.
Joining the conversation at the Hope Table Talk on the last Monday of every month. It's a conversation where people who have experienced loss can come, and it's a virtual event. So I'll send it to you.
Okay, and we will
Yes,
post
Jan,
it.
I do have that.
I thought you had it. Yes.
Yes, we'll post it in our newsletter.
Okay, great. Thank you.
So I want to say to everyone, thank you all for giving us this extra 5 minutes. Those 10 things about what to do with your friends, we got it from XO Nicole in Essence magazine. It's an online site for Black women that has really wonderful and fun information. I want to once again thank our speakers, Pastor Juanita, Katrine Ziroff, work on your name, I promise, and Carol Watson. I want to thank Antoinette and Dr. Sherrod for pulling this together, and for all the folks who typed a list, their names of their loved persons, because we need to say their names. I see Aunt Frankie, and I see Ron Settles, Helen Settles, Larry Matthews, for all those folks who type names and who are leaning in with Black Women for Wellness to celebrate love and to take care of our hearts and to move through this particular time in world history. Thank you all for joining us for Sisters at 8. and share the information forward. We
This is
appreciate
awesome.
you.
This is awesome.
Yeah.
I'm so glad to have participated today, and I want to stay connected with you all.
Absolutely looking forward to it.
Fabulous group.
Absolutely.
I
Yeah.
love it.
All right. So Jalen, if you can like share some exit music, we'll let folks put whatever you need to in the chat.